Hi, this video, this client flew out from a different state. He had 2 procedures in the past at other clinic, and it left him poor density, number 1. Number 2 is a lot of, if you turn this way, a lot of mini plugs. Number 2. Number 3, there's no artistry of the hairline. And basically they just scatter to the back. And then number 4, a lot of patients make a mistake by trying to say, oh, can we close the corner by going straight like this? And if the doctor doesn't understand the artistry of the hairline, will end up doing it. So what he did is he had that whole plugs here. The woman angle is this way. For men, the temple had to be angled backward or a little bit slightly or perpendicular. So, but if the moment you point forward, it will look abnormal, and it look like a woman hairline. So if you can turn this way, I'm not sure the audience see a lot of little mini plugs that he has on the side here. So I have to FUE out some of those mini plugs and really rebuild his hairline for a man hairline for him. So there's quite a bit of wrong that this clinic did. So, and then the angle of the hair on the side, they point it this way, so outward, and that's wrong. The angle of the temple should always be flat and pointed backward. And so we will rebuild his hairline. We're going to do a minimum of 1,500 all the way to maybe 1,800. It just depends how much hair graft he needs. We don't know until we do the surgery. And then it depends how big his head is. Could it be 2,000? Maybe. I really don't know. But we want to do it one time and last time for him. And if you look at my previous video of the before and after, that this client had a bleach blonde on top. We rebuilt his hairline. He had done 2 other places too. Again, with no pore density and no artistry, and the angle of the hair is wrong. So we're going to rebuild this whole his hairline for him. Stay tuned, and we're trying to convince him to do a follow-up a year later, so the audience can see what's the difference between clinic or the surgeon who specialize on hair transplant and who specialize in the artistry of hairline, different than clinic just open clinic for and not focusing on the artistry nor the density part of it. Okay, so this is the art of hair transplant. I lower his hairline, continue with his widow's peak, build his temple forward, and FUE out the mini plug that he had in the past. Now, FUE mini plugs, those plugs are very resistant. So even though the first session you can never get rid of it completely, you can thin it out a little bit. But to get rid of all completely, you're going to be multiple sessions of FUE out the old plugs. It can be done, but you have to watch out for how much scarring if you do a multiple session. So this is the artistry of creating the hairline, increasing density, and building the temple. Thank you.